As if you need more proof that 2020 is shaping up to be an interesting year, just take a look at some of the year's most popular buzzwords so far. First, it was social distancing, then it was flattening the curve, and now it's herd immunity. But what exactly is herd immunity? Does it really mean we all need to get infected to get immunity? Let's take a look at what the experts are saying and get COVID-19 herd immunity explained. Simply put, herd immunity is what happens when a significant portion of the population is immune to an infection, which slows down or stops the spread of the infection. Herd immunity isn't about protecting each individual person, it's really about preventing a widespread outbreak of infection. Herd immunity means that each person who does contract the infection won't be able to spread it to as many, if any, other people. The more people in the group or the herd that are immune to the infection, the less easily the infection can spread through the population. To visualize how herd immunity works, you can picture a group of dots representing people. Blue dots are people who are immune to the infection, and yellow dots are the people who are not immune and therefore susceptible to infection. A red dot represents an infected person. A red dot can infect any yellow dot it comes into contact with, turning the yellow dot to red. The red dot cannot infect the blue dots. If enough of the dots in the group are blue or immune, the red dot won't be able to spread to yellow dots as quickly. But if too many of the dots are yellow or susceptible, then the infection can spread quickly throughout the group. Herd immunity is most important for protecting the most vulnerable and at-risk people in our communities. Older people, very young children, pregnant women, and people with underlying health issues stand a higher risk of expecting serious complications if they contract an infection. People with compromised immune systems, like cancer patients undergoing chemotherapy, are also at higher risk from infection, and these vulnerable people can't be vaccinated due to the potential for serious side effects from even the weakened vaccine, so they rely on herd immunity to keep themselves safe. It's important to note that herd immunity only works for infections that spread through person-to-person contact. Some infections spread only through contact with infected surfaces, not people, so herd immunity is ineffective at preventing their spread. For example, you might contract a tetanus infection after stepping on a rusty old nail, but you won't be able to spread that infection to other people that you come into contact with, so herd immunity is irrelevant to tetanus infections. For infections that do spread from person to person, like COVID-19, once a certain percentage of the population is immune to the infection, its ability to spread slows or stops. The precise percentage of people that need to be immune is called the herd immunity threshold, and the threshold is different for every infection, depending on just how contagious it is. Some infections that aren't very contagious only need about 40% of people to be immune to prevent the infection from leading to widespread outbreaks. In most cases, though, the herd immunity threshold is much higher. We need 80 to 95% of the population to be immune to stop most infections from spreading widely. So if 80% of the population is immune, that means 4 out of every 5 people who come into contact with the virus won't get sick, and they won't spread the virus to other people. Measles is a great example of herd immunity in action. Before 1963, measles infected 3 to 4 million Americans every year, killed between 400 and 500 people every year. Once an effective measles vaccine was developed and a significant portion of the population was vaccinated, the herd immunity threshold was met, and in the year 2000, the American government declared that measles had been eliminated in the US. And yet, we still hear stories of localized measles outbreaks from time to time, like the 2014 Mickey Mouse measles outbreak that saw 52 people become infected with measles after a New Zealand teen with the disease visited Disneyland in California. The scary thing about measles is that it's extremely contagious. Each person with measles can infect about 10 to 15 other people. Because measles is so contagious, it also has a very high herd immunity threshold, 95%, or 19 out of every 20 people needs to be immune to prevent an outbreak from spreading. Anytime a population dips below that threshold, whether because they can't be vaccinated or because they chose not to be, measles can once again begin spreading from person to person. In the case of COVID-19, when the virus first began spreading in humans, no one was immune to it. The virus encountered no resistance, and so it spread quickly from person to person, leading to major outbreaks like what we've seen in Italy and New York. The more people who become immune to the virus, the slower it will spread and the faster the outbreak will end. Early estimates are that 70% of the population will need to be immune for herd immunity to be effective, but we still don't know for sure. More on that in a bit. First, let's find out how we can actually achieve herd immunity. There are 2 ways that herd immunity happens. A significant portion of the population needs to either contract the infection or get vaccinated against it. Vaccines are the safest and most effective way to achieve herd immunity, but natural herd immunity can happen when a significant portion of a population ends up getting infected. Back in 2010, after the global H1N1 swine flu pandemic, researchers in Norway determined that nearly 60% of the population had some form of immunity to the infection, and in many cases this was the result of natural immunity after contracting the disease. Olav Hungnes, a researcher at the Department of Virology at the Norwegian Institute of Public Health, said, "Even though many acquired immunity through infection, we believe that vaccination may have been responsible for most of the increase. Although an H1N1 vaccine was eventually developed, natural immunity certainly played a part in helping Norway to achieve herd immunity to H1N1. So does that mean we should all be rushing out to try and catch COVID-19 now so that we can get it over with? Well, not exactly. To find out why that's a really bad idea, let's see what the experts at Johns Hopkins have to say about COVID-19 herd immunity. According to Johns Hopkins Bloomberg School of Public Health, we're a long way from achieving herd immunity against COVID-19. Based on the early data about the contagiousness of the infection, experts estimate that the herd immunity threshold for COVID-19 is at least 70%. That means 7 out of every 10 people would need to either be vaccinated against COVID-19 or get the disease to develop natural immunity. Since we don't yet have a vaccine, natural immunity might sound like a good alternative, but the researchers at Johns Hopkins are also very clear about the fact that natural herd immunity is not the answer to beating COVID-19. First of all, natural immunity means that people need to actually get the disease first in order to give their body a chance to develop antibodies against it. This means they might have to get sick and experience symptoms, and that can put them at risk of serious complications. COVID-19 is up to 10 times more deadly than the normal flu, and even young and otherwise healthy people have been hit with serious and even fatal cases. And that's another major reason why natural immunity is dangerous. We still don't know enough about COVID-19 and the SARS-CoV-2 virus to know for sure how natural immunity to it works. Research is still ongoing as to how the virus spreads and why some people experience more severe symptoms than others. Researchers aren't sure if even getting the infection actually gives you any immunity at all against future infections. If COVID-19 is similar to other coronaviruses that have been studied, getting sick probably provides some level of immunity, but only for a matter of months or years, not for life. Researchers are still trying to understand how immunity to COVID-19 works, but we just don't have all the answers yet. Perhaps the most important reason why we can't rely on natural immunity to achieve the herd immunity threshold for COVID-19 is because of the huge burden that would put on our healthcare system. Quicker is definitely not better when it comes to infections. We just have to look back at the 1919 Spanish flu outbreak to see what happens when natural immunity plays out on a huge scale. In Philadelphia, one of the hardest hit cities, hundreds of people were dying every single day and hundreds of thousands of people were sick. Every one of the city's 31 hospitals were over capacity, and the city's morgue, which was only designed to hold 36 bodies, was quickly overrun. The city rushed to build 5 temporary morgues, but it still wasn't enough. Unembalmed bodies piled up in the corridors of hospitals, on front porches, and even in the streets, and the smell of death was everywhere. The Johns Hopkins team lays out a worst-case scenario for COVID-19. If no physical distancing measures were in place, the virus would spread quickly, very quickly, infecting many people in a matter of months. The huge number of cases would crash the healthcare system, and we would see a very high death rate. To achieve herd immunity to COVID-19 through natural immunity, hundreds of millions of people just in America alone would have to get sick all at once, a huge burden that our already stretched healthcare system simply cannot handle. So what does this mean for us going forward? Well, we obviously know we shouldn't be trying to catch COVID-19 to speed up herd immunity, but how long will it take for things to go back to normal? Johns Hopkins lays out a best-case scenario for containing the spread of COVID-19 too. If we can maintain current physical distancing measures, we might be able to maintain or even reduce the rate of infections and buy ourselves time until herd immunity can be achieved through a vaccine. This would require the entire population to continue to cooperate and maintain strict physical distancing measures for up to a year or more, and that's the best-case scenario. The most likely scenario falls somewhere in between. It's probably not realistic to expect people to maintain current social distancing for a year or more, but Johns Hopkins predicts that some form of physical distancing measures will need to be in place for at least a year or more, and that life won't truly go back to normal until we can develop a vaccine. But they also point out that things probably won't always be as strict as they are right now, as the physical distancing measures we've already started doing start to pay off, and as more people become naturally immune to COVID-19, we'll see less of the explosive outbreaks we've seen so far in this pandemic. As the rate of infection falls, some physical distancing measures can be relaxed. If the infection rates start climbing again, those measures might have to be reintroduced to control localized outbreaks. According to Johns Hopkins, until we have a vaccine, we won't be able to rely on herd immunity to keep us safe from COVID-19, and that's still a long way off. Scientists are working furiously to develop a vaccine, but it takes a long time to create, test, and mass produce a safe and effective vaccine, and more time to get the majority of the healthy population vaccinated. Until then, physical distancing measures and frequent hand washing are the most effective ways to prevent the spread of COVID-19. It's going to take a prolonged effort on all of our parts to contain the spread of the virus until a vaccine is available and we can safely achieve herd immunity to COVID-19. So now go check out COVID-19 versus H1N1 swine flu. How do they compare? Or this other one instead. If you're going to be stuck at home for a while yet, we can at least keep you entertained.